Hi there, this is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be about a very interesting question that many people ask, and that is, if my loved one had a stroke many years ago, and if we haven't had speech therapy in many years, will it be prudent to consider speech therapy again? So that's a very interesting question. Many people have it. And that again is, if it's been many years since any type of speech therapy has been done, can my loved one improve their speech with speech therapy? And the answer to that is a very simple, equivocal yes. They can improve. And so I can answer this pretty simply, and that is a person capable of learning? That's really what the question is the person capable of learning? So, we can learn lots of things, and we do learn lots of things, and almost everybody can learn something, even people who've had a stroke and who haven't talked for many years. If a task or if something you want to teach somebody is easy enough and it's presented in a way that is easy to understand and makes sense to the individual with aphasia, then chances are they would be willing to engage in the task that the speech therapy or the speech therapist presents. And so I can't tell you how many people I've worked with through the years who haven't had speech therapy, and then they find out that there is someone who is an expert out there, and they decide to check it out. And that's probably the best thing to do for those whose loved ones haven't had speech therapy in many years, and that is check out the individual expert. Check them out, have a conversation with them, maybe even do what we call diagnostic speech therapy. So you might ask, well, Mark, what's diagnostic speech therapy? Well, diagnostic speech therapy is speech therapy that's done with an individual. And during that process of speech therapy, the speech pathologist can determine just how well a person can learn. So if a person has not had speech therapy in many years and undergoes diagnostic speech therapy, then what's going to happen is a person and their family are going to get a very clear picture about the prognosis and about the potential for the improvement of speech. Now, no speech pathologist can say immediately, without seeing an individual, whether or not they can improve with speech therapy. You can't make any particular conclusive statement unless the speech pathologist has the opportunity to meet the individual with aphasia and has the opportunity to engage that person in some simple speech therapy tasks. And how well a person responds will determine the prognosis and will answer the question, will my loved one who hasn't had speech therapy in many years, can they improve with speech therapy? So that's kind of the answer. In summary, speech therapy is nothing more than learning. And if a speech pathologist can present material in a very simple way, then chances are it can be learned. Secondly, diagnostic speech therapy would be what you would want to do with an individual if the family states that that person hasn't had speech therapy in many years. Also, diagnostic speech therapy is always done by a prudent speech-language pathologist when working with an individual, because that's the only way we can really tell if a person's going to improve or not, by basically doing speech therapy with them and observing and seeing if that person can respond, and see if that person is motivated, and see if the caregiver is motivated and willing to pursue simple speech therapy exercises or simple conversations or simple word repetitions at home. All of those factors are significant in answering the question, will my loved one improve with speech therapy if they haven't had speech therapy in many years? So on that, this is Mark Ittleman, speech-language pathologist. I hope you've liked this little video. If you have, please kindly give us a thumbs up. And down below the video are a bunch of links that you can check out in the event that you'd like to consider personal mentoring, or if you would like to purchase a video instructional program for those with aphasia, or for those who might want additional information about apraxia and what we can do to help those with apraxia speak better. There's also links down below to our Facebook page, our YouTube page, and we hope you take advantage of that. So I look forward to meeting you or speaking with you in the future, and I hope that you have a great day today, a great week, a great month, and of course, a great year ahead. Bye-bye now.